All right, so we're now recording. Good morning, everybody. Thank you so much, everyone, for being here. We can see you all. You have your masks on, so don't worry. We can't see your faces, but we're super excited to have a vet tech on with us. Nicole Cooper works for Sage Veterinary Center, and she's going to tell you all about what they do there and her journey getting into there. And then Mrs. Zimmerman sent me your predetermined questions that you all kind of came up with, and we're going to try to answer those. And so for to respect everybody's time, Nicole, I'm going to pass it on over to you.
Hi, how are you guys? Yeah, I'm a veterinary technician. I'm a registered veterinary technician, also known as an RVT. I've been in the veterinary field since I was probably 10 years old, and I've been in my role in various forms in general practice, in specialty, and right now I work as basically essentially a charge nurse. I'm a department coordinator in the emergency department. For about 15 years. I've had a lot of different hats on in the veterinary world, as far as starting off as a vet assistant and a volunteer, kind of getting experience and working my way up, going to school, taking national registry exams, and working in specialty, which is really exciting and fun. But I want to talk to you guys about all the different routes that you can take to your career in veterinary medicine, if that's something you're interested in, and how you get there, and what kind of steps are the best and most fun to take.
Okay, awesome. So I can't minimize my screen. So the first question. Okay, so let me see. So what schools are best known for their vet tech or vet programs, veterinarian programs?
Yeah, so where we are, UC Davis is probably the gold standard of vet school or tech school in the area. It's a wonderful place. If you've never been there and you just want to go and take a drive for the day and check out the campus, it's really cool. They have like all these really cool interactive parts of the campus that you can just walk around and see different types of learning tools that they have. They have this whole cow program there, this whole farming agriculture program there that people are really interested in. I know a lot of people that have gone to Davis just to check it out, see if they wanted to be in vet school, and learned all these different avenues they could take with equine medicine. And they just have a really vast and robust program for nurses and for doctors. Some of the other schools that are just focused mainly on veterinary technology, there's Carrington, which is an 18-month program, and there's a few different locations that are known under the Carrington name. Pleasant Hill is the closest one to us, and they offer, you'll get an associate's degree in animal sciences, and then you'll be able to be eligible to sit for your national and state board exams if you complete that. And then there's Foothill, which I believe is in Los Altos. Los Altos School, Foothill, they offer two different types of programs. They offer an associate's program, which is again another 18-month program, or they have a veterinary technologist program, which is different from a veterinary technician, as they have a bachelor's degree and there's more specialized, geared not just toward general sciences, but specifically towards veterinary medicine. I think a lot of people will take the technologist route to get their bachelor's and then work in the industry for a while. And those are the people that end up like fast tracking themselves towards vet school when they decide later on that they want to wear the white coat. And, having a bachelor's really helps you. That's the first step towards going to vet school, is having a bachelor's degree in either animal sciences or biology or, some kind of healthcare. Bachelor's degree is what you would need for applications into actual vet school.
Awesome. Where did you go to school?
So I took a really fun loop-de-loop route, which I started volunteering when I was really young, and volunteered at some shelters and rescues, and went to DVC and Cal State. I was originally a physical science major. I really wanted to transfer and be a theoretical physicist, which has nothing to do with animal medicine. But as I was volunteering and learning and kind of working at a vet hospital and various vet hospitals, I really just got pointed in that direction as I got older. Used a lot of the college credits that I had from Cal State towards sciences, and took some other classes just online to fill in some of the microbiology blanks and things like that, and then was eligible for my state boards, which was a little bit longer of a route and probably more difficult to take. But that's kind of the way a lot of people in my industry start doing this is, they say, oh, I'm going to do this for a while and as an assistant and not be registered and just, make some money and get my hands on. And then they end up really liking it, and they just, start filling in blanks and picking up classes at UC Davis or online until they have enough college credits in order to be eligible for the exams. It is a little bit harder of a route. I think when people can take a full program that's geared towards veterinary nursing or veterinary technology, you get a little bit more well-rounded because there's a lot of grasping, trying to find those classes individually that are usually kind of grouped together as a package. It's more difficult the way I did it, but it worked out in the long run.
Awesome. So that kind of answers the question where it says, do vet students typically try to climb their way up the career ladder while in a vet program, or is that too complicated?
Yeah, I mean, it is complicated. When you do things, what they used to refer to as the alternate route, it was more difficult for sure, because you have to have the same amount of credits as getting your associate's degree, and they have to be very specific. There has to be a large number of them that are very specific. And when you're not in a program, it is harder to find those specific veterinary classes outside of a school that is made for veterinary medicine, like UC Davis. So it is more challenging to do it the way that I did it. But it gave me a lot of time that I really think I needed at the time to figure out if this is what I wanted to do. And I think it's a lot of expectation that people have is that as soon as you graduate, you have to know where you want to be and know where you want to go. And it doesn't always work that way. So like life throws challenges at you, and you have to kind of see where you're happy. I don't believe that anybody should work in dedicate their life to an industry that they've never at least put their hands in for a little while. And so it is nice that there are so many levels to the veterinary field where you can join in as a kennel tech or as a dog walker at a shelter. And there's such a vast variety of steps you can take that you can really see what the environments are like. And go, yeah, this is something that I want to do or something that I can do. There's a lot of emotional and physical challenges that come with what we do for work. And there's not a lot of ways to prepare yourself for it until you're there and you see things, and you see the ways that animals are treated or the way that people interact with their animals or the illnesses that they come in with. And until you're really in the door and you start seeing these things happening, you won't know how you're going to react to it.
Awesome. So that segues kind of into one of the questions that the students asked were, what advice would you give to a high school student who is interested in the field of animal care? And what could you do if you were a high school student that could have given you a head start?
Yeah. So, I mean, at one point in my life, I was a high school student, and I did a lot of volunteering when I was still in school. It was really fun. I did a lot of different types of volunteer work at the SPCA. I cleaned kennels and I walked dogs, and I, played with cats in their big cat room and provided social skills to the animals that were there. You really just get to, be around them and feel for them in a level of, they're here all the time. They don't get to be around people and they're scared. And providing them some comfort while they're there is a really rewarding feeling. So that was one of the first few steps, is finding somewhere to volunteer. There's a lot of volunteer opportunities out there around here, especially. There's ARF. ARF is a really great organization. They have a lot of different programs that they offer. They have a veterans program and a low-cost spay and neuter clinic. Again, they have their own shelter. So they have a lot of volunteers that they need to come in and give medications and walk the animals and make sure that they're getting enrichment, feeling, mentally and emotionally loved while they're in their spots. I started out as a receptionist. My first paying vet job was at the front desk answering phones. I was not prepared for the things that I was going to be asked. And it ended in some silly conversations, and but I learned a lot really fast, and answered phones for a while, made appointments, and became a kennel technician where I was more hands-on with the animals, learning different restraint techniques and just about the basics of animal care. What vaccines there are available, how the vaccines work and where they go. And general practice is, I think, a really good starting point for a lot of people trying to get their foot in the door in veterinary medicine. There's a lot of general practices, and a lot of them are looking for vet assistants and kennel technicians to come in and be entry level and hold animals for them, and observe the world around them. You'll get to see surgeries happening. You'll get to see various types of diagnostic tests being done, blood work being done, x-rays being taken, and get a lot of exposure in the general practice world. And on a scale of what that means in a general practice, when you are healthy as a person and you just need to go in for your annual physical exam, or you have a pretty mild sickness, a flu or something, and you just need to see a general doctor, that's your general practitioner. That's the doctor that you just go to. And it's the same in the animal world. That's who you call and say, hey, I need to make an appointment, and it takes a few months, but you get in and they talk to you just about, the easy stuff in life. Like, oh, sometimes my knee hurts, or sometimes Fluffy's knee hurts. And general practice gives you, a more low-paced environment to kind of really get your feet wet and see what's going on in the world. But there is a lot of, we do see sick patients, and we do see patients that we've seen from when they were a puppy and they came in for the first time, and when they are a geriatric animal that comes in for the last time. And that's all part of being a general practitioner, is seeing things from start to finish, and more like a family doctor. So that's a good place to start, is to shelters, rescues, and general practices. As you get experience and you kind of work your way up, there's the routes that you can take towards management of a general practice or supervisory roles, or you can specialize and you can work in a specialty hospital like I do. There's a number of veterinary technician specialties that a lot of nurses, after they go to nursing school, will really want to focus on one area that they really enjoyed. Like, I really like dentistry, and they'll go and work for a specialty hospital that has dentistry. And you can actually become board certified as being a veterinary technician with a dental specialty. And it's not easy to do, to specialize in anything, but it is cool. And there's just a whole nother realm that you can get into from there of, teaching as a veterinary specialist. You can have classes, host continuing education lunches, and give people the credits that they need to maintain their licenses, and the education that they need to do their job better. And teaching has always been something I'm really passionate about. So that's always been a route that sounds like the most fun, is to figure out what you like, get your years in, and and then see what specialty sounds like the most fun to you.
Awesome. Can you talk about what an average day looks like for you? I mean, I know you work in emergency medicine, but typically, what does an average day look like for you? And can you talk about like your hours and what we were talking about? Your 312s.
Yeah. So I am a department coordinator in the emergency department, which I think most people relate to as being like a charge nurse. So I run the flow of the emergency room. So when something comes in to the emergency department, I'm the one who assigns a triage nurse, which is someone who gets vitals, assesses the situation, alerts a doctor if anything is actually critical, versus just an emergency. Something that's an emergency and needs to be addressed today versus something that's critical are vastly different things. And I think people in animal medicine, it's really relative when you go to the ER and you're like, oh my gosh, I have a 6-hour wait, and this is supposed to be an emergency, but you think about those people who are coming in that are having a heart attack. That's a critical emergency, versus the people that are coming in and saying, I'm in a lot of pain. I sprained my ankle. And it's like, yeah, that should be seen. You need to be seen, and you need to have pain medication, but this person is in life-threatening distress. It's a lot of the same of what I do in the emergency department, is kind of assessing what cases need to be worked on right away, actually physically working on them every day. I'm hands-on with patients, stabilizing critical patients, performing CPR, placing IV catheters, and running diagnostics, working with the different specialties that are within my hospital, internal medicine, surgery, cardiology, oncology, to figure out where that patient needs to be transferred to once it's been stabilized. You know, a lot of the time that's the goal of an emergency department, is to assess and stabilize what the patient is here for, and then figure out what specialists they need to see. So whether it's an animal that's come in that's been hit by a car and it's in critical condition, it's my role is to help the doctors and the nursing team stabilize the patient, figuring out exactly where the injuries are, what the extent of them are. If any of them are surgical, then the patient needs to be stabilized and transferred to the surgery department so the surgeons can address that. If it's just a critical care patient, then it gets transferred to the critical care unit, and the criticalists and the critical care team nurses will maintain stabilization as much as they can, as long as they can, and until the patient can become stable on their own, and kind of support them through. And that's a lot of what my role is. It's just putting people in the right pathways with their pets and providing them with all the information and updates that they need. My schedule is really cool. I work 3 days a week and I work 12-hour days. So that gives me a lot more free time to spend with my family and my dog. And I like that a lot. I went from managing a practice where I was working 60 hours a week because it was nonstop all day, all night. I was getting phone calls and working and a lot of boring paperwork and tax filing type stuff. But now I get to really enjoy my days off. And there's a lot of different schedules that veterinary nurses have. Some of them work 410s. Most commonly it's 5/8s, and 3/12s is what I do. And it's pretty nice.
Awesome. So one of the students submit a question and they want to know, how do you approach euthanasia and how do you like deal with that? It's a tough one.
Yeah, it is. It's tough, and it will always be tough. I think one of the really hard approaches that you learn over time to look at these things is that euthanasia is really providing a gift that we can give to these patients, to these animals that are suffering and have given us so much in their lives. We're able to ease them in that way. The first time you see euthanasia, for me at least, it really, I was so nervous to see that process happen. You know, I had animals in my life that had passed away or been hit by a car or had been really sick, and you know, had gone to the doctor and I never saw them again. But to actually be there and be part of the procedure, I was really scared of how I was going to feel, and it was extremely peaceful. The injection that we give is sodium pentobarbital, and it's a large dose anesthetic that you give slowly. They fall asleep. They fall asleep really deeply, and then their heart stops. And it's exactly how it sounds, exactly how it looks. They close their eyes, they go to sleep. Their heart slows, their breathing slows, and then they're gone. And it's a good easement for them physically, because a lot, you know, hopefully most of the time when these animals are being euthanized, they're being euthanized because they're really, really ill. It's really uncommon that veterinarians do any kind of euthanasias that aren't related to directly to illness. I know we all hear about euthanasias due to behavior or convenience because someone's moving and they, you know, you hear these horror stories. These things just don't happen nearly as often. Working in veterinary medicine, you know, people are sometimes horrible and will come in and ask us for those things, and our doctors will flat out say, no, that's not what that's for. There's steps you can take to rehome your pet, to train your pet. And if you're not willing to take those, then there's people that will step in and help you with those things. But you know, those are the ones that I would say are really difficult, is when you do have a really fractious animal that is hurting people, and these people have dedicated time, effort, money, everything they could into correcting, you know, behavioral issues, and sometimes they just can't. And those are the ones that you feel that everyone feels like a failure in those situations. But it does happen, and those are really hard. But those are the 2% of euthanasias that happen in the US are related to anything other than illness.
Awesome. Can you talk to us about, the question says the pros and cons of your job. So maybe, you know, some highlights or some hard days. That's obviously not euthanasia.
Yeah, you know, I think there's so many pros and there's a few cons. I think COVID has brought a lot of cons into everyone's life and everyone's career. I think a lot of us kind of think the silly thought when we're first deciding to work with animals, like I love medicine, but I don't like people and I want to work with animals. And then you realize that animals are owned by people and they make not the smartest decisions all the time. And that's difficult and it's challenging. But a lot of the time it's an education thing, talking to owners. So that's both a pro and a con is the working with people, because it's you know, palm to your forehead moment. A lot of the time we were talking to people like, why would you do that? Why would you give your animal this medication that you take for yourself and not think about the fact that your dog is 5 pounds? But they don't have that understanding. And so then you get to access the fun education part of your job and educate people on, you know, metabolizing medications and pharmacology and how these medications work, and how they work with animals is vastly different than how they work with people. Most of the pros, you know, it's a really rewarding job. There's something about being a veterinary nurse and providing healing it with your own hands that just feels right every time you do it. And when you have a patient that comes in that's in critical condition and you spend, you know, 3 12-hour days stabilizing that patient, and sometimes they're 14-hour days because that patient was too sick for you to leave on time. And then you go in on day 3 and that patient gets to go home. That's the biggest pro that you can have, is watching your patient go home. Euthanasias are never, like I said, easy, but you come to understand that there's an amount of fear and pain that you can alleviate, and that's a good thing that we are able to do. And you know, I think one of the biggest cons to veterinary medicine in general is that people don't fully understand from the outside the financial component to veterinary care. One of the toughest conversations that I have several times a day with people is, why is my bill going to be X number of dollars? When I go to the doctor, it's $150. I've been to the emergency room, it always costs me $150. Financial conversations get really tough with people, especially when there's something they love's life on the line. And those conversations are often trying to explain to people that you don't have pet insurance, and the pet insurance that does exist is not the same as people insurance. So the reason that you spend $150 in the emergency room is because you're paying insurance every month, and your insurance is paying the other grossly large number of money. And it's still, we're probably 10% of what human medicine charges. And it's still a sticker shock for people. Even the ones that do have pet insurance, they don't quite understand that pet insurance is a lot more like car insurance than it is like health insurance. It's more like you're insuring your property, and you have this large deductible, and it only covers the incident that's happening specifically. And, you know, understanding all that and trying to explain it to people, that's a pretty big con, but it's part of the job.
Anytime you have to talk finances is a tough conversation.
Right. Yeah.
Before I ask a couple of the you know, COVID questions, what is like the coolest or weirdest animal that's ever come into your office that you've worked on? A typical, aside from the typical dogs and cats and maybe even rabbits or something. What's the
So I've worked with a lot of different species. I've worked you know, dogs and cats at general practice. Every now and then a general practitioner will feel comfortable seeing rats and mice and guinea pigs, and that stuff's really fun. I did a lot of volunteer work and working in hospitals that also saw reptiles and amphibians. So seeing, you know, snakes on a pretty regular basis was really cool. Working with birds, avian doctors, not very many of them, and they are super kooky. They're all really funny, kooky people. Bird people are hilarious. And working with birds, it was really, really fun. It's totally different. They I think a lot of people see birds as being very stoic and not having a lot of personality, but until you get to know a bird, you learn that that's not true at all. They're just like dogs with wings. They're so funny and they have so much personality, just like their doctors. So working with birds was really enjoyable. I did some volunteer work with horses and ponies, and I've done some wildlife. We had a client that used to come into my general practice who had a bobcat that he was permitted to have, and he did volunteer work with Lindsay Wildlife. So he was a rehabber, and he would bring in the bobcat that failed rescue and release, and rescue, rehabilitate, release, and have us help him cut his nails, which was scary, but it was really cool. Lindsay Wildlife is a wildlife museum nearby. I don't know if any of you have been there before, but it's a small organization. When you look at the building itself, it's like, oh, this is a small little museum. You can walk through the whole thing in an hour. But the amount of work that they do behind the scenes, and the amount of work that they do for the community is 100 times that. It's just so cool. They have so many volunteers. They have a lot of people like me that get various permits and equipment so that they can help them rehabilitate falcons, condors, cougars, deer, raccoons. Baby raccoons are the cutest thing if you've ever seen a baby raccoon. Squirrels, things like that. Everything that's native to California, they'll see. I myself hand reared 2 baby foxes. That was probably my favorite experience. Someone brought me this box, and she was an elderly woman, and I took care of her dog for pet sitting for years. It's kind of like a side job. I would pet sit for her. She was so sweet, and she said, Nicole, I found these kittens in my yard and they don't look good, and can you help me figure out how to bottle feed them? And I said, oh sure, bring them in, I'll teach you how to bottle feed. And she opened up the box, and I said, those are not kittens, and I don't know what they are. It took us some time to figure it out. They were foxes. Foxes' eyes stay closed for 60 days, which was how we figured it out finally. But when they were so malnourished and their hair was falling out and they were these skinny little noodles with pointy faces, we went through weasels and chupacabras and everything in the book that we could possibly think of that these little creatures were before we finally figured out these are baby foxes. That was cool. I had those things for probably 6-8 weeks. Bottle fed them, worked with Lindsay to get them rehabbed, and taught how to live in the wild again. And then a few months after that, we got to hike out into the hills and release them, and that was just the coolest thing. You release these full-grown, beautiful animals that you're like, I didn't even know what you were 8 months ago, and you see them go out into the world, and it's a really rewarding experience.
That's very cool. So how has, your job and your career changed since COVID? I imagine a lot of times you rely on volunteers, or some of the organizations rely on volunteers for walking and cleaning and such, and a lot of that stopped with COVID. So how did your job and your career and your industry change with COVID?
Yeah, I mean, veterinary medicine is a short-staffed environment in general. In the best of times, you're not fully staffed because it is hard work, and there's just not enough nurses and veterinarians and assistants to keep up with the fact that every household has 1 to 5 animals in it. So when COVID hit, we were hit really hard. We lost people due to illness that were incapacitated and either unable to come back or unable to come back for a long period of time. We lost people who got sick and passed, and it was really hard for all of us trying to figure out what we were going to do and how we were going to both mourn and keep going. It's been a long year and a half of, and I think a lot of people are feeling really burnt out and really heavy at this point, especially in emergency medicine. It's hard to have volunteers when you can't really set a standard and say, you know, okay, well, if you can't wear your mask and you can't social distance, then you can't be here. And they're like, then I don't want to be here because I feel that that's, you know, not a problem for me. And then animals will suffer because we didn't get the help that we needed. And so it was really challenging. It took a lot of really fast thinking on how we were going to address the situation and keep everybody going. We had to shut our doors and do curbside, which sounds like takeout, but if someone has an emergency now, they pull into the parking lot and there's a big red doorbell that they ring, and one of us nurses, sometimes all of us nurses, when we hear the doorbell, will flood the door and open it and grab whatever emergency it is, bring it inside. One of us will stay out there and talk to the owner, and we have to keep the owners outside. The only time that owners are allowed in the building at this point are for euthanasia visits, or if they need, you know, to use the restroom, then we'll escort them through a side entrance into a restroom that's dedicated for just clients. But besides that, we do not have any clients in the building. People don't love that because they're used to being able to stay with their animal and comfort their animal. But you know, a lot of those people still don't feel it's necessary to wear their mask and will argue with us about it. And we figured that every time we tried to take a step back and allow people in, those situations would start happening. And we were like, we can't put our team at risk in that way. So, you know, our doors are still closed, and they're going to stay closed for a while longer, at least until the vaccine rates get higher, more people get vaccinated.
Gotcha. It's a tough time for a lot of us, and us people with the high schools know we have to wear our masks all the time.
Yeah.
So
I know 12 to 14 hours in a mask. You know, it just got a lot of mask acne at this point, and I think everyone's gone through the whole thing of what mask works for them. Is it cloth, or is it surgical mask, or is it an N95? And, you know, having bruises across our faces in the early days while we tried to figure out how to make our masks work. I had some friends that 3D printed these straps that went on our back of our heads that we could put the ear loops on, because at the end of a 14-hour day, sometimes your ears have cuts in them from those N95 masks, and you have black eyes, and it was really rough the first year trying to figure out what would work for you while you're trying to run around and do your job. And so yeah, it was challenging. I'm sure it's hard for all everyone, you know, everyone's going to school in person again and having to wear a mask all day, and you walk into a room and sometimes you don't know who's in the room because you don't recognize anyone with their mask on and you haven't seen them in a year. So yeah, it's had a lot of its ups and downs for sure.
Lots and lots of challenges. So I have one last question, unless Mrs. Zimmerman puts anything in the chat box, but what would you say to someone who wants to work with animals and loves animals, but is either afraid, like has a fear of like dogs, for example, or on the alternative, like me, who is severely allergic to cats? What do you do there?
Yeah. It's funny that you say that, because I can't tell you how many doctors and nurses I work with that are allergic to animals. they just put themselves at risk. They load themselves up on Benadryl, or they get allergy injections because they just love it too much. And sometimes they don't learn about it until later. Sometimes they're like have had no real exposure to dogs, and their neighbors' dogs or whatever, but now they're working with them every day, and they're suddenly like, my eyes are nonstop watering. I have difficulty breathing sometimes, and I'm like, oh, I dedicated myself to a career and I'm allergic to it. But there's a lot of them. One of my doctors is allergic to cats, rabbits, penicillin, azithromycin. Just being in the room, if someone is drawing up penicillin, is like an anxiety inducing enough for her, where she'll like, we announce it, we're getting antibiotics, step out of the room. But she's so dedicated to her job, and she's one of the best doctors I've ever worked with. And she found a way to make it work for her. There's a lot of stressful times when working with dogs. So if you have a fear of dogs, I don't think that there's any time that you should say you can't do this because you have this anxiety or this fear. I think there's always tools available and time that can be taken to help with fear and anxiety. Behavioral cognitive therapy is really helpful when you, and exposure to the thing that you're afraid of in the right environment is really helpful. As somebody who's worked in this field for a long time, I have been bitten and attacked a lot, and it is terrifying. And I don't consider myself to be afraid of any animal at all. But when it happens and you've been attacked, you're scared for a while. You're gun shy for several months, where you go into work and you're like, I have to do this. I've been doing this for years. And a dog turns around really fast and it's a happy lab, but for some reason your anxiety, you know, it's there, and it takes time to wind it back down and to remember that every time you do get hurt, animals aren't malicious. You know, they aren't hunting us. We're not prey. So anytime that you do have an animal that is fractious, that is trying to bite or growling or swatting or whatever mechanism they're using to express that, it's fear. They're terrified and they don't have any other way to express it, because in the wild, if they express fear, they get eaten. So, you know, that's what you have to remember and tell yourself, is to come into these environments as comforting as you can, because you're not going to challenge a dog. You're not going to challenge a German Shepherd who's barking and growling and snapping in your face. You're not going to scare him into submission. No matter what anyone on Animal Planet tells you, it's not it. They're scared and they're doing what they think they need to do to survive. And there's a lot of movements these days called fear-free environments, fear-free certification. You can become a fear-free hospital. So you can make your hospital become certified as fear-free, meaning that you have taken all the steps and your staff's undergone training to become fear-free, or you can become a fear-free nurse. And it's a certification that vet assistants, kennel assistants, and veterinary nurses can get. And it's that you have gone through the training in how to treat your animals in a way that keeps them as fear-free as possible. And I think that's a big step in learning how to feel comfortable around animals, is learning fear-free restraint and fear-free approaches towards animals. Because if you know, it's easy to get mad at something that hurts you. But when an animal does it, it's not because they didn't like you. They didn't like your personality. They didn't like the way that you looked. They did it because they don't know you and they can't communicate with you. So it's all fear. And if you keep that in the back of your mind and you try to approach everything with kindness, then it goes a long way.
Awesome. And then I have one last question. Again, Ms. Zimmerman, if any of your students have any questions, go ahead and throw those in the chat box right now. But if not, I just wanted to ask you, what is your favorite dog? What is your favorite kind of dog, type of dog, breed?
Oh, that is a hard question. I love my dog, but I would never recommend anyone get one of these. I know probably some of you in the room have one of these. I have a French bulldog. And she is a genetic nightmare. She has so many genetic predispositions and problems. She wears diapers because she has no control. And but she is the best personality in the world. She's the sweetest dog I've ever had. I think the same goes with any of the flat-faced dogs. They're all just genetic nightmares, but they're the sweetest and the cutest, and they make noise 24/7. So yeah, that's my answer.
My brother has one. He's
Yeah.
he's very snorty, as I call it.
Nonstop. It's nonstop.
Yeah, awesome. Okay, Nicole, well, it doesn't look like I'm not seeing anything in the chat box. Is there anything else that you'd like to share with our biomed student or medical pathway students there at Ignacio Valley? Yeah. We're super, super happy that you were able to join us today. I think Mrs. Zimmerman, did you want to say something? Oh, giving you thumbs up. And they're waving at you.
I think the students maybe wanted to see your dog, Nicole. I heard a bunch of ohs when you said
hang on. She's right behind me. She is not the prime example of what a French bulldog should look like, but she's got her little diaper on. There she is.
Cute.
Oh, we had a question. What's the dog's name?
Oh, her name is Rancor. I don't know if any of you know what a Rancor is, but it's the monster from Return of the Jedi that Luke Skywalker falls into the pit at Jabba the Hutt's house and fights. He has a flat face. He's a little disproportionate.
That's very cute. Very cute. Well, thank you guys for participating today.
Any
Nicole,
questions?
oh yeah, any last questions?
I wasn't near my computer to type stuff in. Any questions? Scanning the room.
Awesome.
I think you hit everything. So thank you.
Awesome. All
Thank
right.
you guys so much.
I'm going to stop recording.